Hello everyone, I'm Dr. Darshan Jain. This video is basically on elbow stiffness or the stiff elbow. This could be a result of injury to elbow and which could have been either operated or which could have been managed conservatively. This is one of the most commonest causes. And sometimes it could also be because of a treatment followed by traditional bone setter. And excessive massage or heat application after an injury to elbow is one of the causes which could lead to the myositis ossificans and subsequently a stiff elbow. Inflammatory arthritis also could lead to this condition. What are the problems of the stiff elbow? That is, it means stiff elbows, decreased movements, the very word suggests, and it could also cause difficulty in eating, personal hygiene, and activities which have to reach our midline. It could be associated with the pain as well and locking up of the joints. And one of the other condition where they could have weakness in the hand because of the ulnar nerve injury or because of the neuritis which causes this problem, they could end up with clawing of the fingers, especially the little and the ring fingers. What is the best treatment? It is always ideal to save the original joint if the patient presents early, that is by arthrolysis. And if the joint is significantly damaged, then elbow replacement or interposition arthroplasty has to be done. This video mainly shows the outcome of the arthrolysis of an open procedure, that is soft tissue releases of the elbow joint. Here is a young chap who was operated for his right elbow following a fracture in another setup, and he developed a stiff elbow. You could see that his range of movement is incomplete. He cannot bend beyond 90 degrees or just barely. He cannot straighten his elbow as well. And you can notice his little finger, there is clawing of the little finger as well. The rotations were good. You can, in this images also, you could notice there is clawing of the little finger. His elbow, there was a lot of osteophytes around that. Radial head was partially excised in previous surgeries. So he undergoes surgery, that is anterior transposition of the ulnar nerve with a neurolysis to restore the clawing of the hand, and also the elbow arthrolysis for the improvement of the stiffness. One would generally require 2 days of stay in the hospital. Subsequently, physiotherapy. Ideally, a patient can learn and do by themselves, but under the guidance of physiotherapist is likely to give better results. 4 months after the surgery, you could see the resolving claw hand. His little finger is better, and that's a scar, operative scar, which you can see, and that's the kind of range of movement he's having following the surgery. This is another case. This chap, young male, had a left elbow injury, which he was operated, for which he had a stiff elbow, and he had a severe stiffness. You could see he could hardly bend. That's a jog of movement, just 10 degrees of range of movement. It was a bony block, which was clinically examined. I examined him, and you can see that there is literally a block. Even if you force it, he cannot. And he also has some pain in the elbow joint. The X-ray showed excessive bone formation along the joint, and which lead to stiffness, especially on the posterior aspect. You can see the yellow arrow. He undergoes surgery, arthrolysis, and removal of the bony block. These were the bone fragments which was removed. And immediately after removal, you can see that is a kind of movement he's having. Excellent range of movements. 2 days after the surgery, that's the post-op X-rays, and you can see he's already started mobilization of the elbow. A good range of movement within 2 days after the surgery. This would generally tend to improve further after few months. This is 6 months after surgery. You can see his left elbow. He's got full range of movement, and you can see that's the scar which he's got, which was operated. You can see on his elbow, and he's got full range of movement. He's able to do all his routine activities. The take-home message is arthrolysis of the elbow joint has good outcome, but it has to be followed up with a good physiotherapy, and never resort to massages for problems of the elbow. Thanks for watching.